Hello and welcome to another video from the lecture series entitled Advanced Biomaterials. So in today's video we'll be looking at an interesting aspect of biomedical engineering, which is the preparation of biomedical implants. And in this particular video we'll be talking about a biomedical implant which is known as a stent. So a stent as a biomedical implant. So what is a stent? What are they actually used for? In particular we'll be discussing about stents which are used in cardiovascular tissue, cardiovascular therapy, which is the stent for coronary arteries or the coronary artery stent. So, since these stents are used for correcting or as a therapeutic intervention for treating cardiovascular disorders such as atherosclerosis. So, atherosclerosis as a cardiovascular disorder. Now, atherosclerosis is one of the most significant of the different types of cardiovascular disorders which affect people globally, and it accounts for one of the highest mortality rates among individuals who suffer from conditions such as cholesterol or obesity. So, this atherosclerosis is a disease wherein an artery or a blood vessel is occluded by the deposition of fatty deposits in the interior wall or the inner wall of the blood vessel, which is known as an atherosclerotic plaque. So if this is a cross section of an artery which carries blood to a specific organ or a specific tissue or a specific part of the body, so this is the outer layer and this is the inner layer of the artery. So the inside the interior wall of the artery, it is actually occluded by the deposition of what is known as an atherosclerotic plaque. Now, this plaque deposition will prevent or occlude the normal flow of blood, and therefore through a given cross-sectional area much lesser blood will flow per unit time. So, an artery which is affected with atherosclerosis will have a very low volumetric flow rate of blood through that cross-sectional area. So, effectively, this part of the occluded artery is actually enabling the flow of blood. So, in order to correct this, what is done is angioplasty. So, the therapeutic treatment is angioplasty. Now, what is angioplasty? So, angioplasty or balloon angioplasty it is a minimally invasive procedure wherein which is used to correct or to open up an artery which has been blocked with the deposition of an atherosclerotic plaque. So these are used to prevent. Now this balloon angioplasty uses a catheter, a deflated balloon which is attached to a catheter is placed over a guide wire. So there will be a balloon and which will be guided using a guide wire which will be placed on a catheter. Now that balloon will be introduced as a shrunken state, state, and when it reaches that part of the artery which is containing that occlusion of atherosclerotic plaque, then that balloon will expand and it will clear out that plaque. And after clearing out that plaque, that entire arrangement is removed from that artery, and therefore the normal blood flow is restored in that particular artery. So So this deflated balloon will be attached to a catheter and will be passed over a guide wire into the narrowed vessel, and then it will be inflated to a fixed size. Then this balloon will force the expansion of the blood vessel and the surrounding muscular wall, thereby allowing the improved flow of blood. So in this there will be the insertion of a balloon which will be passed through a guide wire. Once this balloon reaches this occluded part, it will expand and it will, through the flow of blood, this plaque deposition will break into tiny pieces, and this will be removed by the bloodstream, and this part of the artery will revert back to its normal diameter, and the blood flow to the subsequent or to the given organ will be restored. Now, often it has been found that these blood vessels collapse or undergo further deposition of these plaques when they are just treated through angioplasty. So, in order to prevent the collapse of these blood vessels or to prevent further deposition of these fatty deposits known as the atherosclerotic plaque, often a biomedical implant known as a stent is introduced into that particular blood vessel. After this balloon is is withdrawn, then there will be this stent material which will be placed inside this occluded artery. So this stent will prevent the collapse of the artery or will prevent further deposition of or further plaque formation in that particular artery. So in this particular video we will be looking at coronary artery stent. Now what is a coronary artery? If we just look at a very brief diagram of the heart, so there will be atria and the ventricles. So the coronary artery will be the artery which is responsible for supplying blood to the muscles of the heart tissue. So this will be the coronary artery. Which supplies oxygenated blood and nutrients to the muscles of the heart wall, which enables them, which provides them with oxygen and nutrients to beat and to perform their normal function. Now, if in this part of the coronary artery is getting occluded by the deposition of some fatty compounds, so the artery which is responsible for supplying blood to the heart muscles the blood flow will decrease, and if the blood flow decreases, there is life-threatening consequences which can lead to heart attack and many other cardiovascular failure and many other types of severe necrosis of that particular area where it is not supplying blood. So many other further complications can arise because of this occlusion or blockage. So in order to prevent this from happening, a coronary artery stent is often placed in this occluded part of the coronary artery after this angioplasty. So a coronary artery stent is a tiny mesh tube made up of a number of different types of materials. So it is essentially a tube which looks like this. It has a mesh-like pattern . So several wired-like structures which are fabricated in a mesh-like pattern. So this will be basically how a stent will actually look like. So this mesh-like structure enables the stent being very flexible. So it can deform according to the properties or the mechanical properties of the blood vessel, and also responds well to the rheological flow of blood. Because blood is constantly in contact with it, therefore this stent has to be fabricated with materials of desired properties. So this is a coronary artery stent or any stent which can be placed in any artery. So once this stent is placed in the coronary artery through this angioplasty procedure, where after this removal or the clearing of this atherosclerotic plaque, so this stent will prevent further deposition of materials. So once these stents are placed, so these will prevent reclosure of a blood vessel after angioplasty. Now, this stent may be inserted at the time of ballooning to ensure that the vessel will remain open. So often this stenting procedure is a follow-up of the or is performed simultaneously with the process of balloon angioplasty in order to ensure that after the removal of the atherosclerotic plaque, the vessel does not close or does not occlude further. So it will ensure that the vessel will remain open, then the balloon will be deflated and will be withdrawn. So the stent will remain in position of the given artery or the given section of the artery. So now, what is it made of? So it can be made of materials such as metals, polymers, and composites. Now, different metals and alloys have been used for the fabrication of these arterial stents. So the metals and their alloys which can be used are the medical grade alloys such as stainless steel, cobalt chromium based alloys, so cobalt metal alloys, and polymers have also been used for making these stents which belong to the materials such as polycarbonates, polylactates, so polylactic acid, PLA, have been used for making these types of stents. So now, what are metals? So metals, as they're used in these polymeric stents or in these arterial stents, are actually non-biodegradable in nature, and theirs will maintain their morphology for a very long time. Maybe it has been throughout the life of the patient. So these metal stents, if not surgically removed, will remain in the section of the artery in which it is introduced. Now, so since the material is not biodegradable, so what might happen is that after a very long amount of time, that metal might start interacting with the endothelium of the blood vessel, and also it might start interacting with the blood which comes into contact with it. So when blood is actually coming into contact with it, the cells will interact with the metal surface, and clotting might take place when blood directly interacts with the stent material in future. So this process is known as a very important medical consideration while designing any type of or a particular type of stent, is thrombosis. And restenosis. These terms essentially mean clot formation and narrowing of the artery in which the stent is placed, because the stent will interact with the blood, and therefore in the clotting cascade or the pathway which is responsible for blood clotting will be activated, and the clot will again form on the surface or on the periphery, on the section where the stent is placed, and that will again lead to closure of the artery and reduced flow of blood through that section. So that is why these stents need to be it is not desirable that these stents be kept in a cross section of an artery for a very long time. So for these, scientists started using polymeric or investigating different polymeric materials, which could be used as suitable alternatives to metals as stent fabricating materials. So most of the polymers which are used are biodegradable in nature. So once we are placing the stent in a particular cross section of an artery, or if we are looking at the coronary artery disease or coronary artery atherosclerosis, so the stent will be placed inside the coronary artery, and then after a particular point of time when the blood flow has returned to normal, and also the characteristic of the muscle of the outer layer of the artery has reverted to its original strength and original functionality, then this stent material will slowly start degrading or slowly start resolving inside the artery itself, and that biodegradable product will not have any toxicity on the body whatsoever, and it will be automatically resolved in the body. So that is why these polymeric materials are drawing much significant attention in fabricating such novel types of stent materials to prevent such conditions. Now, how can these polymeric nanoparticles be made, or these polymeric stent materials be made? So there is a technique. There are several ways in which these stents can be prepared. So one of the most recent and one of the most convenient method of fabricating such materials is through the process of 3D printing. So 3D printing. So this is the process of this stent fabrication. So for this, a 3D printer is required. Now, this helps in the process which is known as personalization. Now, what is it and what is the application of, or what is the advantage of this procedure? So let us assume that a person has this blockage in a specific cross section of, or in a specific section of this coronary artery. Now, what is done in this 3D printing technology is that the whole area is scanned through advanced imaging techniques such as CT scans and this other types of imaging techniques, which enables us to which gives us a three-dimensional representation, or a representation of the area of the artery, or the cross section of the artery, and also the length in which that plot is formed. So based on that image, through these 3D printing softwares, we can create a model of the actual dimensions of which should be required for that particular stent to be fabricated. So now from that model, those dimensions or the parameters are fed to the 3D printer. Now, after feeding those parameters, the 3D printer will print the given stent material exactly as with the dimensions which was required. So, if the internal diameter of the coronary artery is about 3 to 4 millimeters, then exactly the stent will be fabricated through the 3D printer, which will have dimensions which will be exact to that of the particular section of the artery or the coronary artery in which the stent has to be placed. So this is the application of 3D printing technology, wherein for any specific person, for any specific location, for any specific cross-sectional area of the artery, we can create a stent material, we can create a stent which can be placed exactly in that particular location, which is very specific from patient to patient and from different condition to condition as well. So this is the power of this technique, or this is the main advantage of this 3D printing technique. So now different new modifications have been made into this stent fabrication technique, wherein these stents can be loaded with different types of drugs. So such stents which are loaded with drugs and which will then release the drugs in the body or in the bloodstream in that particular cross section of that artery where the stent has been placed are known as the drug eluting stents. So these drug eluting stents are mainly used for correcting this thrombosis and restenosis, because once this stent material is if this biodegradable polymeric stent material is placed inside an occluded artery, so then the stent material will actually start releasing. So from the surface of the stent, these drug molecules will be released into the bloodstream, and these drug molecules will actually have certain cardiovascular benefits which will prevent the interaction of the platelets with the surface of the stent materials, and therefore will prevent thrombus or clot formation. So such types of drug eluting stents have an immense application in the fields of therapeutic engineering or therapeutic biomedical device fabrication, where so different surface modifications, different types of drug molecules, different functionalities can be added to, can be complexed with these different types of stent materials, both the natural, the metallic, polymeric, and these composite based stent materials. So to prevent this thrombosis and restenosis, or the clotting or the narrowing of the artery to take place after the stenting is performed. So this promises to be an effective cure for this atherosclerotic artery disease, and a lot of research is being performed in this domain, and this promises to improve the cardiovascular health of individuals and also the longevity of patients who have undergone such stenting procedures, to improve their life, to increase their life in future. So in today's video we have seen about stents as a new or a modification in different therapeutic interventions of these improving cardiovascular health among patients. So these stents have been used for some time now, and now newer manufacturing or manufacturing processing techniques are being used. So 3D printing is one of them. Newer drug eluting stents to prevent thrombosis and restenosis for inside these atherosclerotic arteries are also being developed, and these promises to be a great help to patients who are suffering from such diseases. So hope you enjoyed this video. Thank you.